Low-threshold treatment programs in Czechia are still somewhat a controversial topic, even though they shouldn't be. And I mean, they shouldn't be controversial, not that they shouldn't be. A lot of things I'm going to talk about in this video are somewhat specific to the way things are done in the Czech Republic, but I still think that it can be interesting to see how things are done all over the globe, so even though if you're not from this country, you might still enjoy this video. I actually have a short experience with low-threshold treatment programs in Czechia, as it is obligatory to do an internship in one of them when you're studying addictology. During this internship, I had the opportunity to get to know the low-threshold treatment program in Sokolov. Later, I also worked part-time in a low-threshold treatment program in Mladá Boleslav, and unfortunately, I worked there for a couple of months and I had to quit the job to focus on my studies more. Still, it was a great experience. According to the report on illegal drugs in Czechia in 2023, there are approximately 250 to 300 addiction treatment services in Czechia, and 55 to 60 of them are low-threshold treatment programs. Now, these programs fall under tertiary prevention and they use harm reduction principles. This means that they are trying to mitigate the harmful consequences of addictive behavior, and the low threshold part means that the barrier to entry is virtually non-existent. Anyone can use these services, and there's no need to provide like IDs or your name or even be sober, which is important because a lot of services require you to be sober, but not this one. Users of these services are clients, not patients. They enter the contract on their first visit and it's just an oral agreement. So what services can you actually get at a low-threshold treatment program? Well, these programs offer a variety of social and addiction treatment services. They exist to help people in various situations. The target groups are active users, families of active users, people who are experimenting with substances, and former users who are seeking support in their sobriety. Let's take a look at the individual services you can actually use at these centers. There's gonna be 10 of them, although individual servers might offer only a subset of these. These include counseling, needle exchange programs, testing, hygiene services, food services, support for various events, crisis intervention, support for integration into the society, support in further steps, and various other minor services. In the following section, I will go through each of these services and tell you a bit more about them. So, counseling. You can turn to them if you're dealing with problems yourself or if you want an advice on someone else who's close to you and who's using drugs. These centers provide advice and support in like social, health and legal areas, and they can also inform you about like safe drug use and safe sex. Needle exchange service. This is the most important service these centers actually provide. They offer the option to exchange used injection materials such as needles or syringes for a clean set. This helps minimize the risk associated with drug use and the spread of diseases. And usually the system is like 1-for-1, so users are expected to bring back used needles to get clean ones. As a result, they will not leave them lying around in public spaces. Sometimes the staff is actually benevolent and they don't strictly adhere to like 1-for-1 exchange, but they are really trying to encourage clients to bring back their used needles because you don't want them like lying around. And the used equipment can be then prepared for safe disposal. During the exchange, there's space for like more personal contact between the client and the worker, so the worker has the opportunity to interact with the client, ask him how he's doing, if anything has changed since the last time, or if they need help with anything specific. During the exchange, clients can also receive information about safer drug use, how to inject properly. And thanks to the equipment and better technique, health risks can actually be really minimized. You can basically get rid of disease transmission through like shared equipment or various inflammations or abscesses caused by improper injection technique. Clients can also receive like additional paraphernalia to make the injection as safe as possible, such as cotton swabs, disinfectant wipes, sterile water, foil, or ascorbic acid. Gel capsules or clean straws are also available. Containers designed for safe storage of used needles is also available. Testing. Some centers also offer condoms and pregnancy tests. And in some centers, it's also possible to get tested for infectious diseases such as hepatitis B or C, HIV, or syphilis. These tests can be done under half an hour, and all they require is a little drop of blood from your finger. A positive result must be confirmed in a lab though, so you cannot get like the full testing experience there, but still it's something. And pre-test and post-test counseling are provided. Hygiene services. Unfortunately, clients of these programs are often homeless, and that means that these people have limited access to basic hygiene such as showering or shaving or washing their clothes. Now, these services are available to them at these centers, and usually the clients can shower like twice a week and wash their clothes about once a week or every 14 days. Some centers occasionally offer clothes, which can be especially important in winter when it's really cold. Food services. Some centers actually offer food service and the opportunity to use a contact room in which you can warm up, make tea or coffee, or have a warm meal. Support in social situations. Well, this type of client is often associated with like social stigma and can be excluded from other services, so visiting an office or doctor can be difficult. A contact worker can go with the client and defend their rights or accompany them to a job interview. Contact workers can also help find and recommend other social or health services. For example, they can help a client apply for a place in a treatment program. Crisis intervention. The workers are often trained to help in a crisis. Support in integration into society. Most programs offer a computer and a telephone. The client can use them to handle everyday matters, they can contact loved ones, authorities, or look for work. Programs also offer trainings, and the skills can be then used to help the client integrate better into society. An example would be communication with an employer or writing a CV. Support in further steps. Low-threshold treatment programs can help inspire clients to make the next step and start the treatment elsewhere, but they never force them into it, and this decision is always up to the client. Other services. Some centers offer occupational therapy, and that basically means that the clients can perform like minor maintenance tasks for the center and receive compensation. Homeless clients can store their personal documents in the center so they wouldn't lose it or it wouldn't get stolen. And they can actually redirect mail to the center if they don't have an address. What surprised me was that I found at least 2 centers that offer excursions for high school students, and many of them also allow students in relevant fields get their internships in them. So to recap. Low-threshold treatment programs offer services such as counseling in social, health, or legal areas. They can also teach you about safe drug use or safe sex. They offer needle exchange programs and testing for some diseases, and they can also offer hygiene and food services and can assist with various day-to-day tasks such as job interviews or doctor appointments. The program is based on a couple of principles. Personal information about the clients is protected and workers are bound by confidentiality. Clients can freely discuss their problems with them except for stuff you are obliged to report by law. An example of this would be murder or cooking meth. Workers have to approach clients with respect and the service is always free of charge. So, what are the main principles? You can try pausing the video and answering yourself. There should be 6 of them. So it's accessibility, necessity, anonymity, free of charge, expertise, and humanity. But there are some rules the clients have to follow. And although you can come in under influence, there is a ban on smoking, drinking alcohol, or using or distributing drugs directly in the center. There's a strict ban on physical and verbal violence, and in case you violate any of these rules, you might face sanctions such as ending the contact and the service for the day, limiting access to certain parts for a predetermined period, such as being unable to spend time in the contact room for a week, or suspending services altogether, although this usually is for a predetermined time period as well. The public opinion on low-threshold treatment programs is divided, but it's sort of leaning more towards the negative side. In 2021, the mayor of Ostrava Vítkovice initiated a petition to relocate the Rinarkon Center, and in 2022, the contract with the Progressive Center in Prague 5 was terminated. But according to addiction treatment experts, including the national coordinator, the solution to the problem with drugs is not in closing services, but we actually need more of them. The termination of contract with Progressive was actually connected to a petition organized and signed by residents of Prague 5. And while internet comments regarding the closure may not represent society as a whole, they highlight the lack of understanding and solidarity towards drug users. And I mean, yeah, it's understandable. We should totally focus on minimizing the impact these services have on residents. But it's also important to provide these services to people, and although you might not completely agree with their actions, they are still people. Like actual human beings. People in the comments, for example, believe that drug use should be penalized, which makes sense because nothing helps you more in a difficult life situation as a criminal record. Many people actually dehumanize drug users altogether because that's a guaranteed way of ensuring that they will want to productively engage with this kind and understanding society. When I was preparing this video, I actually came across some really interesting comments. And using your real name and publicly writing real cruel comments on the internet is certainly a life choice. Some people are clear. Prague does not need any of these centers. These centers are for junkies, and without it, the junkies will leave Prague. What can I say? You're either a junkie or you're from Prague, but you cannot be both. And of course, it's the simplest solution of them all. If they go elsewhere, they don't exist. And it's not my problem anymore, I don't care that they suffer. It's also weird that these people are actually trying to assess if someone's life is pointless or not based on an article on the internet. And then there are the glorious opinions, such as that Prague or the rest of the Czech Republic has no anti-drug policy. The person has never actually heard on TV that drugs are bad. And let's not forget my favorite comment. Fortunately, this gentleman realizes that methamphetamine users are not inferior to other people who need help. The solution is to close all non-profit organizations and send the sick to the mines. And I didn't bring these comments here to make us feel superior, but to show that outside of your usual social bubble, people may have some really weird opinions. Reading these comments makes me wonder, because I really thought that some things were normal, and then it turns out they're maybe not. And unfortunately, even though these comments are somewhat cruel, it's true that we need to minimize the impact these services have on residents of the city. Okay, yeah, maybe they are able to reduce the number of used needles lying around, but turning a neighborhood into a gathering place for drug users who are often under the influence and frequently homeless, and unfortunately that also means smelly, is not ideal. And no one wants to walk their children to school in the morning and see people shooting up on their doorstep. Unfortunately, this problem is extremely difficult to solve. And I'm not trying to argue that unrestrained drug use is the best thing that ever happened and we should definitely deliver you a free sample of drugs on your 15th birthday so you can choose your addiction. Yes, many people actually start using drugs when they're young and vulnerable, and sometimes it takes just one occasion when you were at the wrong place, at the wrong time, and this all spirals. Suddenly you really need a low-threshold treatment center. But dehumanizing these people, comparing them to animals and denying them access to help because it's all their fault is not the way to solve this problem. Did they bring it upon themselves? Yeah, maybe a bit, but that can be said about a lot of things. You broke your leg because you were not a better skier. And if you were a good skier and someone else broke your leg, then it's still your fault because you should have stayed at home. Skiing is dangerous. So you see that this argument is probably not a good argument at all. In one of my next videos, I would actually like to focus on how people can turn around their lives with appropriate support. And it's not true that if we stop supporting homeless people or junkies, they will die out and disappear forever. And countries where drug use is severely punished actually suffer from hidden populations and diseases that could have been prevented. And by the way, according to their website, Progressive has not found a new place yet. According to Deník N, the situation in Prague 5 did not significantly improve and people just move like a street, so there you go. So, how would I sum this up? The goal of low-threshold treatment programs is to help the clients lead and develop their everyday lives and also to protect public health at a societal level. The goals include stuff as reducing the number of deaths, promote safe use or abstinence or substitution, and prevent drug-related crimes. They're also trying to reduce prejudice that people have against drug users and want to create a clean environment. At a societal level, these programs make a lot of sense since they are able to reduce the spread of infectious diseases, and this helps to reduce the burden on the healthcare system and is actually way cheaper giving someone clean syringes than it is treating their HIV. The basic attributes of this service are to provide a safe environment of trust and anonymity, exchange of injection material, basic individual counseling for clients and their loved ones, social work, crisis intervention, and providing information. And if you are in the Czech Republic and you are looking for help, you can check out the help map. I'll leave a link in the video description. Thanks for watching.